I would like to give an overview of the governing bodies that have oversight over transplant programs, as well as information about transplant regulations, quality assurance, process improvement, and adverse event monitoring. The Ronald Reagan UCLA Medical Center is a nationally known transplant center. Specific outcome requirements, which are statistics showing how well our patients do after transplant, need to be met by transplant centers, and we are required to notify you in writing if we do not meet those criteria at any point prior to or during your evaluation, or while you are waiting for a lung transplant. Patient and graft survival results at UCLA Health within the first year after surgery is similar to or better than the national average and comply with Medicare outcome requirements. Transplant outcomes vary according to pre-existing medical conditions, for example, poor kidney function, and age. The waiting time and results of transplantation of every transplant center in the United States is updated twice a year on the Scientific Registry of Transplant Recipients, or SRTR, and United Network for Organ Sharing, UNOS, websites, and is accessible at srtr.org and unos.org. Median survival 5 to 6 years after lung transplant. In general, 90% survival at the end of 1 year. Please refer to SRTR numbers for current specifics, found at srtr.org. The numbers may be different for different situations, so please ask your doctor about your specific diagnosis and survival percentage. UCLA is a Medicare-approved transplant center. Therefore, if you have Medicare Part B at the time of transplant, your anti-rejection medications will be paid by Medicare for life at 80% of the cost of these medications. If your transplant is not provided in a Medicare-approved facility, it could impact the ability to have your anti-rejection medications paid for under Medicare Part B. The most recent 1-year patient and transplanted organ survival data, compared to the national averages, are provided to you in writing at the time of your evaluation. These statistics for every transplant program in the nation are released every 6 months to the public and are found at the SRTR website at srtr.org. You may ask for assistance from your transplant physician or coordinator for any question about using this website. SRTR also provides a 10-minute instructional video on YouTube to explain how to understand the data on the website and can be found at the link below. Here is a snapshot of the SRTR website where you can research data about the survival for your transplanted organ at any center. Simply select the transplanted organ and enter University of California, Los Angeles Medical Center, or CAUC, and hit the search button. The United Network for Organ Sharing, or UNOS, is a nonprofit charitable organization that serves as the nation's transplant system known as the Organ Procurement and Transplantation Network, OPTN, under contract with the federal government. OPTN maintains the one national waiting list for the United States and defines organ sharing policies to best use donated organs. Organs are offered according to federal regulations, and the OPTN monitors every organ allocation to ensure compliance with laws. Please visit unos.org for more information. As an informed participant, it is important that transplant candidates know their treatment options and rights. Some patients choose to be placed on the waiting list at more than one hospital, change hospitals, or transfer their waitlist time to a different center. At the time of your transplant evaluation, you will receive written information about these options in a handout called Frequently Asked Questions about Multiple Listing and Waiting Time Transfer. Additional information may be found at transplantliving.org. Multiple listing. National transplant policy allows a patient to register for a transplant at more than one hospital. This does not guarantee an organ will become available faster or that all centers will accept multiple listed patients. It is up to each transplant center to decide whether they will accept you as a transplant candidate following their evaluation. Check with your insurance provider to see if they will agree to cover your transplant evaluation and care at each center. Transferring waiting time. Patients may switch to a different transplant center and transfer their waiting time to that center. In order to do this, a patient must be evaluated and accepted for listing at the new transplant center. Waiting time from the original center is added to the time collected at the new center. The transplant teams at the first center and new center will be responsible for the exchange of information and notifying UNOS of the transfer of waiting time. Here is an example of the brochure you will receive at the time of your evaluation. Please read it and sign that you have acknowledged the information included inside the brochure. Variability among transplant centers. Hospitals can vary widely in the number of transplants they perform and the characteristics of the donor and recipient pool. Donor and recipient information is initially matched by many factors that are entered into a computerized matching program. Some factors include blood and tissue type, how sick you are, your size, distance between the donor and recipient, time spent on the waiting list, and other donor and recipient medical factors. Additionally, organ procurement organizations, or OPOs, may vary widely in the number and types of donors they receive each year. The Centers for Medicare and Medicaid Services, or CMS, monitors and certifies all transplant centers in the United States. UCLA is a CMS-certified transplant center. Unscheduled site visits occur every 5 years, or if CMS receives a complaint about a transplant center to review. Compliance with CMS policies and procedures, patient and transplanted organ survival data, tours of the facility, staff and patient interviews about the transplant process. UCLA has dedicated Transplant Quality Assessment and Process Improvement, or QAPI, staff dedicated to monitoring the performance of each transplant program, as well as ensure we deliver the highest quality of care to our patients and their support networks. The QAPI staff work closely with program and hospital staff to develop projects focused on efficient processes, compliance with all regulatory standards, and the delivery of outstanding patient care in order to ensure the best outcomes and patient satisfaction possible. Each transplant program analyzes every unexpected or negative event or outcome to see if there are process issues that need to be adjusted to prevent future occurrences. UCLA has a very robust adverse event reporting and monitoring system for all departments, including transplant. Transplant and hospital leadership are actively involved with identification of issues and problem solving in both the inpatient and outpatient settings. Analysis of events also includes reporting of corrective actions to the United Network for Organ Sharing, or UNOS, or other entities as requested. Always feel free to talk to any team member about any concerns. The United Network for Organ Sharing maintains a toll-free number, 888-894-6361. If you or your family have questions, complaints, or concerns about transplantation data, organ allocation practices, or this transplant center. Other resources can be found at unos.org, transplantliving.org, donatelife.net, or transplants.org. We have strict privacy policies at UCLA Health, and only those directly involved with your care will access your medical information. We are also held to the same confidentiality standards with regard to your organ donor. We will not reveal any of the donor's identifying information and will discuss the donor's medical history with you only as appropriate for decision-making and your transplant care. You will be provided with instructions after transplant if you would like to send an anonymous thank you letter to your donor's family.